Okay, everyone, welcome back for session 3 of our Eye on Mental Health this year. I'm Danae, I'm your host. I'm also an ocular melanoma patient, and today I'm joined by our guest speaker, Dr. Tara McCannel from UCLA. She's an ocular oncologist at the Stein Eye Institute. We're so glad to have Dr. Tara McCannel here with us, and I've actually heard a lot about you from so many different patients. And like I was telling you earlier, I got to participate in one of your webinars that you did specifically for patients. And I believe you also have a podcast that you do for ocular melanoma as well, or that you have in the past. Do you want to tell us the name of that just so that people can find that?
It's called Finding Your Way with Ocular Melanoma. And it's just, I just find myself explaining a lot of things, and people just need to hear information and from a perspective that's different. I mean, I don't think we have a lot of resources that are provided by the physician and the person who kind of deals with this. And I think it's just really important to have people understand and learn in the best possible way. So it's just a way to get information out that anybody can get. And I'll have a slide that shows that. So if anybody wants to listen, and I try to, every few days put some topic that's come up that I've been engaged with and find that it might be helpful for other people.
Awesome. Well, yeah, I'm super excited. And if you guys haven't followed on the I Believe podcast, my co-host Megan was actually able to interview Dr. McCannel about proton beam therapy, which is a subject that I haven't been able to cover yet. So go ahead and head over to the I Believe podcast, subscribe on YouTube for A Cure in Sight, and you can also listen to her talk there. But we are so glad that you are helping contribute to the library of resources that we can have just as a patient population, patient community.
Thank you so much, Jeanette. All right, I'm going to share my screen. All right, so I want to share my experience and my perspective on mental health and ocular melanoma. And I'm from the University of California, Los Angeles at the Stein Eye Institute, and I've been an ocular oncologist there for a couple decades. So I'm going to just go over, this is sort of a summary, how I came to embracing mental and emotional health as an ocular oncologist, views to consider having assessed your mental health in the setting of ocular melanoma. I am going to talk about anxiety and uncertainty with appointments and scans and share an approach that I share with people, and then talk about ways to improve your own mental health, and also touch on how improving your mental health may be key to beating ocular melanoma. So these are some of my disclosures. I'm at UCLA. I'm a professor of ophthalmology. Finding Your Way with Ocular Melanoma is a podcast that Danette mentioned. I also have another podcast, Mind Body MD, where I interview physicians who have a holistic approach to health. And then I'm also a founder of an acupuncture for anxiety studio in Santa Monica. And this is something I'm very excited about. I just published a book for patients and families. It's called Finding Your Way with Ocular Melanoma. It's very basic. It's a starting point to help get you kind of situated with information as you're learning everything on your own. And this is a website that I've put up that has all of my videos, it has all the podcasts, it has webinars that have been recorded, and you can go to this website, sayheart.com/ocular melanoma. And I am doing another webinar coming up later in the month of February about the role of mindset in cancer survival. And I'll put this up at the end. So if you remember anything from what I tell you today in this talk, just remember that your mental health is something that can be changed. There are so many variables in our health, and our emotional and mental health is something that we can alter. It's flexible, it's never rigid. And I also want to just have a caveat that if you believe that your mental health is such that you are having trouble functioning, or you can't carry out your responsibilities, working, etc., I would encourage you to seek the help of a mental health professional, whether a clinical psychologist or a psychiatrist. I think that goes without saying. So how did I get involved and have become extremely passionate about people's mental health? When I first started at UCLA as a very new ocular oncologist, the thing that I felt, I had just learned that you can learn about a person's prognosis through tissue in the tumor, but nobody was doing biopsies. Nobody was getting this information to give to patients. And every time I'd bring it up, someone would say, oh, well, that doesn't affect medical care. And I kept thinking, well, people want to know. They want to know if they have a high risk or a low risk cancer. So this is the very first paper that I put out on that. And, since then, many centers, and I think it is considered almost standard of care now to get information about the cancer, regardless of whether it changes how we manage you. And so working in that setting and thinking about what information does to people, I began to collaborate with the health psychology or with the psychology department at UCLA. And I really began looking at what are the effects of ocular melanoma on mental health. And we have put out a lot of papers in this area, which beforehand there really was nothing on health psychology and specifically with ocular melanoma. And, as has been talked about before, getting a diagnosis can be very traumatic. And some people say that, oh, eye cancer, it's the worst possible thing. And, many times when a person first learns of this, in the same breath, they hear, oh, you might die, you're going to go blind, and we have no idea, there's nothing we can do. And we're just thrown into this chaotic mess of all these things might happen and we can't do anything about it. And this can be extremely disturbing, and it is clearly life altering. And I've heard this over and over again with new people and how information is given, and there's so much we could be doing that it's better. And this is my colleague at UCLA, Dr. Stanton. She's just an amazing person who has put out so much data and research in other areas of cancer, especially receiving information, unmet needs, quality of life. And, she has thankfully taken a great interest, her and her team and the grad students that we work with, in better understanding ocular melanoma and what people experience. And some of the things that we looked at and discovered were that, people want information about their prognosis, whether or not it changes their treatment plan. So information by itself is very important. We also looked at unique quality of life factors. People with ocular melanoma have slightly different needs than other cancer patients. So this is a very unique area that we can't just treat like any other area of cancer. And also, looking at unmet needs, like what do people really need who have this cancer? It's really these two things, information and social support. It's not very complicated. The more you know about this, the more you understand, the more that it's clear, the better people do. And social support. We need people around us. We need a community of people that we can lean on, who can support us and who are providing what we need to get through this. We also, this is more recently, we had a paper on benefit finding, which is basically the silver lining in something catastrophic, a favorable experience. And what people found happened to them with an ocular melanoma diagnosis is that it strengthened relationships, and it increased our gratitude for what we receive. And it also showed that people who are approach oriented as coping, meaning really leaning into the diagnosis, did better. And people who were more avoidant and didn't really want to know anything about the cancer and how it was affecting them, that was associated with more depressive symptoms. And we found that vision, whether we had it or not, whether it decreased or not, did not affect whether someone did not change the benefit finding. And then recently we published this paper that looked at what is depression correlated with. And depression is sort of a metric that's evaluated because there's so many physical problems that accompany people who do experience depression. And so if people looked at their disease as a chronic illness, that was more associated with depression. And again, it came up that people who were more avoidant rather than approach oriented also had more depressive findings. So again, information is so important. And so we often think of, well, people get really upset because maybe they're going to lose their vision, but vision was not correlated with any of the depressive symptoms. And, we really want to look at how does our health psychology, how does it affect metastatic outcome? And maybe can we influence our physical disease by improving our mental health? And this is something that I really am pushing, and we have done some studies in this area, and this is just the beginning, but we need to keep going in this area to find out all the ways that we can be helped. So to summarize things, how can we cope with this best? So face your cancer head on, learn about it, engage, ask questions, and then help others who are going through this or may need support. And so lean on your network of family, friends, and loved ones. Focus on optimism and gratitude, sort of benefit finding. Think about all the positive things that have come out with this experience. And then the other thing is to kind of decide how you'll respond to the cancer. Don't let other people tell you how you're going to manage this. And a lot of times our healthcare team does influence us very heavily, but you can decide how you want to think about it. For example, things that don't serve you, like saying, I can't see with one eye, when, clearly many people here and many individuals who have difficulty with their vision can do very well. And when people say, oh, I'll probably die of metastatic disease, you don't need to think that. So decide intentionally how you want to think about this. So, sometimes when we think of ocular melanoma and affecting mental health, there are many ways to look at it. And, I just throw this out there. I want you to think about different ways, maybe that you're coping with this or that you're viewing your whole cancer. And we often think of, we get a diagnosis of ocular melanoma, and then because of that, we suffer from anxiety and depression and stress, and it's sort of a cause and effect. So we don't have to look at it this way. And I think that, we have this cancer, we have this diagnosis and the treatment and the scans, and there's research on trying to figure out how to treat this better and how to treat metastasis better. And we don't think of mental health as part of the picture. We may carry this idea that my mental health is suffering because I got diagnosed. And, at UCLA, we schedule an appointment with counselors and social workers who have expertise in our cancer center who know about ocular melanoma. But what we find out is that very few people, like 1 in 20, are going to make an appointment to also work on their mental health. And I think a lot of people feel that, well, it's not really related, and I have to just deal with the cancer and it'll be fine. But mental health is something that we might be able to improve. And so just sort of a step back, what is mental health? And the World Health Organization defines mental health as a state of well-being that allows people to cope in life, to realize, this is cut off on my screen, and all the things that help people live and work well. And it's like a multifactorial palette, like what goes on in our minds. And it's shaped by our past experiences, maybe having to deal with chronic stress, acute stress. Some part of it may be related to genetics. And so I think of what mental health is as it's a sum of our thoughts and feelings and kind of our brain patterns, what we walk around with all the time, that determines how we respond to everything that happens in our lives. And, a possible thought to consider may be that it might not just be the diagnosis of ocular melanoma. And a lot of times when I talk to people, I find that, people are just wishing that it never happened. And so we kind of blame the melanoma and we blame all this stuff as reasons why it's contributing to our reduced quality of life and our stress. But, we can't take away that, and we can't undo getting diagnosed with ocular melanoma. So what can we do to take more control over our mental health? And I think one possible way to think about it is to consider that the ocular melanoma might not be the only cause of mental health. And if we step away from the ocular melanoma part and just look at our mental health, we take back responsibility for ourselves to help change and improve our mental health. We stop pointing at the melanoma and the cancer, and we look at what else can I do to improve the way I live, to view my life differently, and choose how I want to think about things. I had the opportunity to listen to the last session, and there definitely is anxiety around appointments. And there are, the eye appointments and it's the scans. And with the eye appointments, the reason we encourage people to continue getting their eye checked is because we always want to check that the melanoma is killed. We want to look for side effects. We want to look for things that are more common and that we can treat, so that we always are in the position to do something to improve our vision if we can. And we also want to check the other eye and make sure that that eye is doing well. We want to look for cataract and glaucoma and more common things that happen to people, not melanoma. And I always recommend that if there's something unusual like new bleeding or some fluid, that the treating ocular oncologist weigh in, because many times we may be seeing a different eye doctor and something looks a little different, and the first thing that we think about is that maybe the cancer's coming back. So we want to when we go to these appointments, we're always thinking that the tumor might come back or maybe the treatment's failing. And usually any change in vision, any symptom like a new flash or a new ache, we naturally think that the cancer is returning or something very bad has happened. And I encourage you to always confirm with your ocular oncologist or the ophthalmologist before you let your mind take you somewhere where it's not very helpful. And all these thoughts come to more deeper concerns that this cancer could be metastasizing, or maybe fear that losing their vision might mean I won't be able to function in life. And so the anxiety around appointments is real, but do check and get the questions answered. Now, for the medical oncology appointments, we do this for monitoring for metastasis, and there are a whole bunch of different ways this can be done. Some MRI, CT scan, whole body PET. Some people do ultrasounds. And this may be for some people every 3 months, every 6 months, every year. And then some people graduate out after many years by doing different things. And this idea that we call this scanxiety, and I've sort of read a lot about this and kind of tried to understand this as best as I can as someone guiding people with this. And scanxiety is this feeling of being so overwhelmed, the whole world may be falling apart. It's difficult to focus on anything because of the sense of total catastrophe. And, I have talked to people who say that they just choose not to do anything because they'd rather not have that anxiety. So this is very serious. And, as has been talked about before, the treatment process of ocular melanoma moves very quickly. Suddenly you're just coming twice a year, or maybe you're coming once a year. And some people return to their lives as before. They have their routine eye and liver checks, but others may feel overwhelmed with uncertainty. And uncertainty can be distracting, it's emotionally disruptive, and our brains just want to know what's going to happen. And we find ourselves maybe ruminating on the worst case scenario, and that causes more anxiety. However, different people handle this differently. They can have the exact same cancer diagnosis, but different people approach this. So, how can we address feelings of uncertainty? So, uncertainty comes up all the time because we all want to know what's going to happen, and we want to be able to live our lives and plan. So, the first thing that we can do is deal with the information. So, sometimes uncertainty can be fueled by not enough information. Maybe you're getting information that's conflicting or misinformation, and you're not clear with the facts in your head. So, again, learn everything, get educated about every aspect of this, and become an expert. At some point, it's not unreasonable to expect that you may know as much as your ocular oncologist. So I would encourage everybody to strive for that. And once you have a better grasp or a good grasp of the information, your brain and thinking can just be a little bit more organized and neutral. It's not sort of jumping to things because you're not sure. And it's important to acknowledge all the feelings that you're having. And, whether it's getting diagnosed, the worries that you have, it's important to just let those feelings of feeling disappointed, maybe sadness, or feeling totally let down, lean into all of them and acknowledge each awful feeling if you have them, and then let each one go. And I'll talk about this in a bit. I always recommend journaling because it helps. It's a way to engage very deeply and just face all the feelings that you're having. And it's important to engage and really acknowledge the feelings rather than sort of avoiding things or pushing them away or repressing feelings. Because if you can acknowledge them, you can also manage them better. And so one way that you might consider doing this is sort of reframe the purpose of your appointments, whether they're the eye appointments or getting the scans. And think of the purpose of being thorough and getting scans is actually to gain information. And with more information, it actually improves the certainty of our situation. So seek out the appointments, go to the scans with, okay, I'm going to learn what I'm going to learn about what's happening in my body. Because the more I know, the more I can actually do something about it. And it's okay to let yourself just imagine the worst case scenario and what you're going to do, and then imagine the best case scenario. So we want to get checkups to confirm that the cancer is dead, get scans to know how the liver is doing, get information from the biopsy so that you have more information about what's going on. And so view these follow-ups as just opportunities for more information so that you will be able to make decisions and choices in your life that make sense for you. So here's a 4-step scanxiety approach that I find that sometimes can be helpful with patients that I've shared. And the 4 steps are acknowledge your feelings, plan in advance, stay in the present, and then reframe how you think about uncertainty. So number 1 is just acknowledge your feelings. And it's okay to feel worried when your health or test result is not yet known. Just recognize and notice your feelings without any judgment. And then talk about your feelings with people close to you, whether it was mentioned before, you have a therapist, or you have close family, or you have a close friend who is helpful in your support system. Acknowledging your emotions rather than pushing them away or suppressing them helps you manage them. And sharing your experience with another person helps build closeness and connectedness with others and helps to lighten the emotional load. And step 2 is plan in advance. So on the day of your scan or series of appointments, when you get the information, set a routine and make a schedule and include something fun that you look forward to, like maybe going for a coffee or a walk with a close friend or family member. So you also have something pleasant that you're looking forward to. Bring a person, a close family member or friend with you to the visit. And then practice mindfulness breathing or meditation, if you know how to do that, more frequently in the days leading up to your scan and also on the day of your scan. Because if you prepare in advance, you reduce surprises and it ensures that you also have a positive activity to appreciate. And planning and making a schedule also gives you more control over that period of time. And third is stay in the present. So focus on things that are within your control, that bring you joy, that are purposeful. So time with friends, exercise, volunteer work are some things that people like to do. And you can use mindfulness techniques to stay in the present. And really, meditation is simply practicing being aware of the present. And there's breathing exercises. There's box breathing where you count to 4, hold your breath, count to 4, slowly exhale, hold it for 4, and then inhale again on 4. Or there's a 5 senses meditation where you go through each of your 5 senses and you acknowledge and recognize a few components of each. And these are things that help ground you in the present. And if you find your mind drifting to, oh, what if they find this, or what's going to happen in the future, just acknowledge the thought, let it go, and just refocus on the present moment with a simple meditation technique. Gratitude practice is something that helps us appreciate the things that we have rather than focusing on what we might not have. And mindfulness, these sort of staying in the present, it reduces anxiety by keeping you in the present. And also, nobody has a certain future, so we have to embrace this moment. And then the 4th is reframing the uncertainty. And I talked about this before, but shift your mindset. Recognize that uncertainty is just a part of life, and it doesn't always mean that bad news is coming. And focus on what is possible. So every scan and test provides information and the certainty to help your healthcare team support you better, no matter what the result is. And if you can reframe and shift how you think, it may reduce your anxiety because it helps you accept things that are beyond your control. And you always have the ability to change things that you can control, like improving your emotional and physical health. So how can we think of melanoma differently? And mental health and ocular melanoma, one way is to sort of, it's just an experience that has come your way in life to maybe show you how much help you may need with your mental and emotional health, to show you how you may need to grow and change your attitude maybe that you've had before with life. And sometimes the people who may struggle the very most with getting this diagnosis and who are just having the hardest time, they might have had issues before their diagnosis of melanoma, where the melanoma just happened to be something that came along. And this is actually good news because you can change your mental health. And mental health and how well you are emotionally is something that you can change and you do have control over. So, what are some ways that we can improve our mental health and ways that we can work on it? And as I said before, in the landscape of cancer, when we don't have instant cures, mental health and emotional health, this affects our physiology and we can change it. Three things that I talk to people about all the time, especially my patients, are gratitude. So, a gratitude practice. And this is focusing your thoughts intentionally on the things that you do have in your life. And one simple way is to just every day list three things that you're grateful for. And what gratitude does is it shifts our minds and it makes us more open. And there's data that shows that people who practice gratitude, people who pray regularly and thank God for what they have, they actually live longer than people who don't. So there's a lot of physiology behind this. And at the minimum, it just helps you feel more grounded and appreciative. And as long as you're alive, there's something to be grateful for. And your circumstances may be the same, but you can choose to focus on the things you have rather than ruminating or feeling upset about the things that you don't. It's just a choice, and practicing can help. So then meditation, we talked about that, and that's just being aware of the present moment. And I find that, everybody, our brains pull us to the past with regrets or guilts or things that we can't change, or our minds pull us to the present or sorry, to the future where we're sort of wondering what's going to happen, how are we going to manage this and my family and things, and yet we can't really do much about that. We only really have this very moment. So practicing meditation, mindfulness, I would recommend if you can 10 to 15 minutes a day, whether it's breathing, five senses, guided meditations that were mentioned, they're so helpful. And, as somebody who not too long ago started meditating like for a few minutes every day, after 5 to 6 weeks of doing it every single day, you will feel like a different person. And I encourage you to just stick with it. So, journaling, and this is something that is a way we have so much going on in our minds and we worry about things or we have thoughts that bother us and when we think about feeling uncomfortable, it's usually related to some thought that we have in our mind, and journaling is a way to completely face that. And there's this book, it's an older book now, it's called The Artist's Way, but I encourage you to order yourself a copy of this and start doing morning pages, which is you just basically fill 3 pages of words every day and you just write everything, just write whatever comes to your mind. And not only does this help you see and have all your thoughts come forward so that you can acknowledge them and decide what you want to do, it's also, we don't just want to survive with this, we want to thrive and contribute to the world. It also is a way that you can figure, it's a book about finding your creativity. And so it's just a beautiful way to help you pull out what's inside of you that you want to give back. And as you discover thoughts as you journal, you can decide that some of them may not serve you, or you realize that it's this thought that's not making me feel very good. So I highly encourage journaling. So why else does it matter that we improve our mental health? Well, better mental health makes us feel more calm, present, grounded, and our mental health is deeply connected with our physical health because, we think about medicine and the eyeball and we think of the liver and things happening in our body, but our minds and bodies are inseparable. And earlier it was mentioned our autonomic nervous system and the parasympathetic and the sympathetic responses, and sympathetic being fight, flight, or freeze, and the parasympathetics being more grounded. Those connections affect every single cell in the body. And people who have a more positive mental health and also who have a more positive mindset, there are lower levels of stress hormone, cortisol in the body, immune function is improved, and we also are in a mindset where we're more proactive. We decide to take action and make decisions that make us healthier. So mental health is not just a feel-good thing, it's actually changing how our body is. So what might be possible if we think of mental health as something we can alter and that our mental and emotional health can affect our physiology. Well, if we can address our stress, anxiety, depression, and really work on everything going on in our minds, maybe we can beat ocular melanoma. And there's some data out there already that shows that people who have certain close relationships do better with ocular melanoma. And I keep showing this picture of a melanoma, but I just saw this patient 3 days ago. He has like high risk everything. And this is like, we're going on 19 years. And I can describe this person's mental health. I mean, this person is just optimistic, goes to church, gives back to his community. There are reasons why some people do better and some people don't. And we have to understand that better. And so, final thoughts, working on your mental health is critical to beating ocular melanoma. So don't just treat it like an outside, by the way, we're going to maybe see someone. Make it central. It's just part of how your whole body responds to everything happening to it. And especially when we don't have a cure for cancer, work on your mental health because that can be changed. My strong feeling is that as much as we need to be looking at more therapies and understanding the science behind how this happens to us, we also need to focus on the bigger picture by making mental health and mental health research a priority. So, why is this a good idea? Well, we're not that good at predicting how people are going to do in ocular melanoma, and especially things like metastasis and death. Yes, we have markers that help us with probabilities, but those are not set in stone. And what is it about people, just talking about their vision, you can have the exact same melanoma and one person has 20/20 and one person doesn't have sight after 6, 7, 8 years. And what's different about those people? We don't quite know. And about people who we would expect, with the high risk markers, like the latest COOG data came up. I mean, a whole bunch of those people don't have metastasis compared to some that do. And what's different about those people? And that's where I really believe we need to go and study and figure out what's different so that everybody can change what they do and improve what I think has a lot to do with mental and emotional health. We're just not looking yet. So work on your mental health because it's critical to beating ocular melanoma. The people who do really well with this, there's something about what they're doing that we need to learn. And so I just put up my resources again. I mean, learn all you can. You want to get information. You want to lean into everything. Foster your close personal connections. Work on yourself and make this a priority. Make mental health and how you think about this really paramount to this. And I am doing a webinar on the role of mindset in cancer survival and the science behind a healing attitude, because not enough people in medicine are looking at this. So I just think that we can't not look at this because your mind and body is one, in my opinion. Well, thank you so much. And
Yeah.
I'm happy to answer questions.
Dr. McCannel, this has been incredible. I have loved listening to every single second of this. And I just have to say that, mental health is something that I have been passionate about for really the majority of my young mom life. I have an 11-year-old and I had really bad postpartum depression. And now we're here and I am 4 years plus into my ocular melanoma diagnosis. And protecting my mental health has been a huge priority for me. And so honestly, every year when I get to do the Eye on Mental Health sessions and bring these kinds of resources to patients to just highlight just how important this can be, it's absolutely one of my favorite things. I geek out on this all the time. So I'm glad to hear that you're someone who also feels like this goes hand in hand, that there's something to be said for having the mindset and having what I like to call like a resilient attitude. We've had patients who actually are therapists and psychologists and they're in school and they're studying like a resilient mindset and how does that affect the outcome, like you said. And so I absolutely love that you are studying this, you've studied it, you have published papers, and that you make this a priority. For our audience, as you guys are listening, if you do have questions, you have things you'd like to ask Dr. McCannel, we have about 10 minutes, and so we can take questions. But until I see questions come in the chat, I will go ahead and just kind of ask you a few questions or just make a few comments if that's okay.
Yes.
So, okay, the last thing that you were saying, you were talking about how important it is to study these people who are doing well despite maybe the statistical odds, right? And I have shared this before, so I'll just share it with you. But any of you guys listening, I'm sorry if you're hearing it again. My ocular oncologist here in Phoenix told me within a few months of my diagnosis, it was when we were talking about the biopsy. And I was debating, do I get the biopsy? Do I not? And she told me that no matter what the biopsy said, she wasn't going to treat me like a statistic, and that I was my own person and that my story was still being written. And so I took that to heart really early on in my diagnosis, that, you know what, that was what I was going to fall back on. No matter what bad news could come, what scary things could end up happening or not happening, that I was going to lean into that idea that, you know what if I was my own statistic? And I used to do like life coaching where I would work with a life coach, and he just called this like a what if of possibility, where it was this idea that, instead of thinking of all the scary what ifs, right? My brain is very good at catastrophizing. It was time to look for the possibility. And I think that's kind of similar to what you were talking about, like with the benefit finding.
Oh,
Um,
yes. Yeah.
but I want to ask you, so I think optimism is so good, right? But I think that what we run into as patients, especially in an online setting, is you run into friends, well-meaning family members, like well-meaning people in your community, even other patients sometimes, who will tell you, like, especially if you're having a bad day and you're just like looking for some validation, maybe you're just looking for advice or somebody to have a story similar to yours, and you'll get inundated with comments back or people in your life who tell you like, oh, no, 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 just be positive. Just be positive. Can you just explain the difference between benefit finding and someone just like trying to tell yourself to be positive? Like, what's the difference here?
Yeah, so that's really a good point. I mean, being positive and having a positive mindset isn't something you just snap your fingers and like, there's a term called fake positivity
Mhm.
where you just only think good and don't think anything else. Really, like a positive mindset is one where you appreciate the things that you have, where as you say, you look at possibilities. And someone asked me recently about, how can I know having a positive mindset is so important, but my mindset is negative, or I have negative parts, and I can't just eliminate them. And so it really comes down to, what are the thoughts that are behind, your negativity, because we all have feelings about everything around us, but it is really like the thoughts that we choose to accept about that. Like we could
Mm.
say, okay, like say that, you have a class 2 biopsy result. You can decide that you're going to be like, oh my gosh, so I'm pretty much doomed and this is just bad news and I can do nothing. You can decide to think that way, but you can also think, well, not everybody with class 2 gets metastasis. There are lots of people. There like more now that more time is passing, we know there are hundreds of people who have class 2 that are alive and well, and you can just say, well, I'm going to be the person who I have a high probability, so I'm going to use that to improve what I do, change my life. I have to redo some of the things that are not serving me, so now I can change. And you can look at it as an opportunity. So we might need help. Like some people just don't know how to get out of funky thinking or just, catastrophizing, as you say. And sometimes talking to a therapist or a life coach or someone to kind of help you recognize those thoughts that are just not serving you. It sounds very simplistic, but if you break down why it is that you're feeling negative, there are things that you can do to adjust that and reconsider, and like journaling and writing things down, really getting to the root of why you're feeling that way really is key. So, you
Yeah.
know, when you hear someone say just think positive, it's much more than that. You have to go
Yeah.
back to why do you feel the way you do anyway? So I would say just, it's meant with good intentions,
Mhm.
and you just have to acknowledge that, well, like they might not be subject matter experts, but that's okay because they mean well and I'm going to work on myself.
Yeah. Well, and I think that what I'm hearing from you is, it's important to develop what is called a reframe. And if you guys don't know what a reframe is, good news. The next session, we're going to have someone who's going to talk all about reframes and cognitive behavioral therapy. So stay tuned for our next session. We will go into like, how do you do that? How do you develop that toolbox? But just know that like Dr. McCannel has been saying, this is something that can be developed. It's not something that like, oh, like I don't have this toolkit, or I don't have these mental health supports or these strategies in place, and so therefore I'm helpless. We can develop these, that we as human beings, our brains are so really incredible, and that we can adjust, we can pivot, we can adapt, I think is the word that I'm looking for. Okay, you mentioned gratitude, and I love this, but I'm gonna just be a little bit of a blunt person here and tell you that
Yeah.
sometimes when I'm in that rough spot, right, when I've gotten some really difficult news, or I'm just still kind of grappling with a lot of uncertainty, that's what's happening for me right now. I'm dealing with a recurrence with metastatic disease, and I still don't have a treatment on the books. And so it's getting really frustrating, and my anxiety can get really, really high when I dwell on those thoughts. And so gratitude is definitely something that helps me, meditation, but like sometimes it takes a lot of willpower to like get myself to do those things, even though I know that they're, helpful. So instead of gratitude, I started looking for three good things this month. It's a gratitude practice, but it feels different than like I'm grateful for this, I'm grateful for that. Like there's just something about me saying like, okay, like what was one good thing that happened today? Just one. Like, and it could be something totally unrelated to cancer, something totally unrelated to really anything substantial. It could just be like, okay, well, my vacuum today cleaned my kitchen and that was a good thing. Or, my kids wanted to snuggle today and like my son gave me a hug last night. That was a good thing. Looking for those little things. I think that one of the things you touched on was this idea that our brains focus on what we're giving them, right? And my past life coach, who we've actually had speak on one of these seminars before, he says all the time, what you focus on expands. Have you ever heard the analogy of if you go and you look for, I don't know, like a red car outside? Then like suddenly you're going to see red cars everywhere because your brain is now scanning for that. And so if you're looking for all the ways how this is going to be hard, right? And how this is going to be scary, your brain will find all the scary things.
Yes.
Our brains are so good at looking for answers. But if you
Yeah.
start looking for the questions of like, okay, well, what could go right? And what if it actually turned out better than I thought it could be? Then your brain starts to see those possibilities. And I don't know, there's just something really neat about like having that happen to be able to experience that shift from where you're so worried and you're so scared to, oh, actually, here's where I can focus and this feels better. It doesn't make what happened to you go away, but it
Right.
feels different, right?
Yeah. It's
Anyway.
just how you choose to view things. And,
Mhm.
I think I like how you say, what's one good thing? Because I feel like a lot of people talk about like gratitude is almost becoming a word that is so frequently used that it's losing what it really means. And so
Yeah.
just change it to say, well, what are the things that happened today? Well, what am I really thankful for? Like I can drive to my appointment, or I don't have to like take a plane. It's right here. And then that gives
Yeah.
me more time. There's really an infinite number of things, but you just need to kind of think of a few
Yeah.
and just refocus and just decide that I'm going to focus on this and just tell your brain what to do, because your brain will just do stuff automatically, and it
Mhm.
tends not to be productive or serve us because our brain is like always in like survival. And if it feels like it just wants to be cozy and comfy and whatever's easiest for you to do, or whatever patterns that, in your past that like the way that we think is just sort of, it's just what we know. And, but you can change that, and that the coolest thing about this brain area is that, our brains change, neurons change, and patterns of thinking can change if we practice. We know they can, and we just do it over and over and over. And eventually you're going to think differently. And that's really miraculous, I think.
Yeah, no, it really is. I have years of therapy under my belt, just before even doing my diagnosis, and years of life coaching and group life coaching. So I've done a lot of work to work on this kind of reframe pattern to start to recognize and develop that self-awareness is really what it is. But it's something that everyone can develop. And it doesn't matter where you are in your journey with your diagnosis, you can start today. And I love one of the strategies that you pointed out on one of your slides was just acknowledging the feelings, right? Like just naming it has so much power. And when you start to learn and understand more about how the brain works, you talked about the fight and flight and like just kind of taking it from this survival brain, the lizard brain, some people call it, where
Yeah.
that's all your brain's focus is. I got to survive. I got to escape the tiger. I got to, escape the mountain lion, like whatever. Then taking it from that to a little bit more logical side. This is the side of your brain that can solve problems. And our brains are very good at solving problems. Guys, we're
Yes.
human beings like that as a generation, as a culture, as a people, like we have developed technology like this. Like humans came up with this at some point. Like our brains are so good. So just trusting that that is possible for you, even if today feels like a hard day. This question comes from someone saying, okay, my stress is high when I'm asleep. So how do I mitigate like stress that's happening when I'm even not conscious? That's a really good question. How would you suggest?
Well, I think that you can only work on things when you are conscious, and sleep is important. And so if you, while you're awake and your conscious time is when you need to work on that. And I think meditation, like meditation practices, have been shown to reduce serum cortisol, and the things that you do in the daytime affect the kind of sleep you have at night. I've read a lot about sleep and the importance of sleep on health. And some people say that, your whole day, whatever you do during the day, is in preparation for the most incredible, healing, calm sleep. And so you be very conscious of what you do in your daytime because it's going to affect your sleep. Somehow you have high stress during sleep, or you measure chemicals in your body and things are a little out of whack when you sleep. Go back and look at what you do during the day. See what you can change. That's what I would suggest.
Yeah. And so like just some ideas, like just knowing that I have struggled with this because I get really anxious at night sometimes, like because that's when my brain stops, right? That's when it's not even when my brain stops, it's when my body stops and I'm no longer able to keep myself physically busy. And so then my brain starts to kind of work in overtime to think through all the things that it hasn't fixed yet. And some of the things that help me during the day is like exercise. If you can exercise, take a walk, get some sunlight even. Those are all good things that are going to influence your sleep. And then, if you need to, like having some kind of a sleep aid or an anti-anxiety medication, prescribed by a psychologist or psychiatrist, any of those kinds of things can be helpful. But I think that when we're feeling that kind of stress and that extra anxiety, one of the worst things is that, in the moment you feel like there's no way to stop it. And I know like I was feeling that the other day, like I was getting really conflicting information from recent scans and it was like, okay, I don't know how to deal with this. I can't talk to my doctor yet. And I was actually lucky enough to be on the phone with somebody who was like, hey, like I know I'm a complete stranger, but I'm just going to tell you, like you need to go and you need to put yourself like on the ground and lay down on the floor so that you can ground your body. Being the person that I am and trusting in meditation and the grounding practices and just some of the ways that we can connect to ourselves better, I resisted doing that all day. And then I finally, like the anxiety was so bad that I just finally laid down and I did it. And I just plugged in my headphones and I listened to some kind of a guided, I don't know, bilateral stimulation to reduce anxiety. And I just laid there for 15 minutes and I put the timer on and I said, okay, I can stay here for 15 minutes. My therapist tells me if you can't meditate for 5, you probably need to meditate for 30 minutes because that's how much your body is telling you need to slow down and to kind of allow that parasympathetic nervous system response to kick in to allow the recovery. So important to recognize there's resources out there to support you in doing this. You don't necessarily have to do it alone. So YouTube, like, I don't know if you have any apps that you would recommend, Tara.
There's an app called Insight Timer, which is a free app that does meditations. What was really helpful for me when I started to do some meditation was the Calm app, CALM. You do pay a yearly subscription, but they have every day there's a 10-minute guided meditation. So if you're new and you just don't really know what to think, there's a voice that is talking you through. So guided meditations are, and there's so many free ones. You don't have to pay money necessarily.
Yeah, exactly. Thank you so much for this invaluable resource for our ocular melanoma patients. Somebody on the comments actually just said the Breathe app is another really good one. I think I've actually used that one before. And I want to just, emphasize too that like meditation isn't necessarily like, oh, I'm going to sit here for 50 minutes or I'm going to sit here for 30 minutes or even 5 or 10. Sometimes it's as simple as a few deep breaths just to kind of recenter your nervous system. Those are just little tricks, right? And again, back to therapy, back to talking to mental health professionals. These are the kinds of people that can teach you those strategies and show you just how accessible they are and how simple they can be. And the more that you practice them, the easier it gets.
Well, thank you so much. It's an honor to be on this webinar, and I really appreciate the chance to talk.
Thank you. And again, like Dr. McCannel said, she does have a webinar coming up if you want to learn a little more about the science of mindset and like how your mindset influences your health. I'll make sure that we can like share that widely in our on our social media platforms. But thank you again, Dr. McCannel, and those of you guys listening. We will see you guys in the next session.
Thank you.